Hello, everyone. I'm Dr. Tricia Elliott, and I'm your host today for our webinar. Welcome to our webinar, and thank you for joining us for today's webinar, where we're going to be talking about integrity, identity and inclusion, and reframing professionalism for a new era, featuring Dr. Andrea Anderson. So this is the second in a series of 3 webinars in the Inclusivity and Health Equity webinar series. And it's brought to you by the Society of Teachers of Family Medicine. This series will present strategies for instituting data-driven practices to promote inclusiveness and health equity alignment with federal and state policies. So during this webinar, please go ahead and utilize the Q&A feature that you see there to ask questions of our panelists. And although you may ask questions at any time, we will set aside time at the end of this to answer your questions at the end of the presentation. Now, the next webinar in this series, it will be Staying at the Table, Leading for Health Equity While Protecting Your Peace. And that will air on Wednesday, June 10th. So please register for that webinar on the STFM website. We'd love to see you there also. So we're going to go ahead and start today's webinar with a short poll to help us know who's in the audience today. You'll see that poll on your screen now. So we'd like to see, are you a medical student, a resident or fellow, UME faculty, GME faculty, administrator, or coordinator? If I missed your who you are, you can also put that somewhere in the Q&A, and I'll try to see if I can find that. But go ahead and answer that, and we'll take a look at that while I do a bit more of an introduction. And just remember, please check out our Inclusivity and Health Equity webinar series page on our STFM website. So, Dr. Anderson, I am delighted to be in conversation with you today and welcome you. So Dr. Anderson, she's a family physician, and she's also the immediate past chair of the American Board of Family Medicine. And she has shaped the future of board certification and professionalism for more than 110,000 family physicians across the United States. She's a nationally respected leader in medical education, professionalism, physician assessment, and health policy. And we're grateful to have her for this important discussion on professionalism. She's also not only chaired the ABFM's Professionalism Committee in the past, she was elected, as I mentioned, as chair of the board, and she has championed rigorous standards of competence, compassion, and accountability in medicine. She's associate professor at the George Washington University School of Medicine and Health Sciences, which also now has a Department of Family Medicine there in Washington, D.C. And she has also been recently elected to the National Academy of Medicine, where she is serving on the National Academy of Medicine Standing Committee on Primary Care. So thank you so much for being here. And we're going to go with Andrea and Trish today because I've known you for so many years. I've looked up to you and your work and admired all that you've done in this space of professionalism. You are an expert in this space and you've done so much work. And I cannot wait to have this conversation with you today, Andrea. And I'm going to go ahead and
Thank
recognize
you.
our poll. We've got a lot of GME faculty, UME faculty, a few students and residents. So we've got a great audience today. And so please make sure you fill out any questions that you may have. And we also welcome, yes, our administrators and coordinators here too. So thanks for being here. All right, Andrea. So today, our conversation, we're going to take a fresh and thoughtful look at professionalism because it's not this fixed, narrow concept. We're kind of move beyond tradition, because it's really evolved, right? Alongside the realities that we're facing with our learners now, our patients, our communities, and how we want to be and present and be there for our patients and communities and our learners and each other. So in medicine, it's been taught, traditionally as a set of expectations, maybe behaviors and standards, but also within our educational and clinical environments, we're more now diverse and we have to better understand the influences on professionalism. Could be influences of culture, identity, power, bias, all those things. So we're going to ask a few deeper questions as we take some time later in the conversation today. So this is especially important for us in family medicine because we're also so deeply relational, right? And so we're trust and humanity, and that whole concept of community takes a much deeper role for us. So we're going to explore a lot of this today. And I want it to really be meaningful, that it's very timely because in medical education, these are concepts that we're dealing with every single day. So let's just start with that. Let's start with the definition of professionalism. How has that evolved? How do you define it, and where are we today?
Thank you so much, Trish. I'm so excited to have this conversation with you. And I definitely have always admired your work and your leadership in family medicine. So it's so wonderful to be here with you. And I would just like to start by saying a little bit about my why for professionalism, why it's so important, and why I'm so excited about it. I think for many people, unfortunately, when the term professionalism comes up, it conjures up a lot of things. Some people not so exciting things, and sometimes not so positive things. But we really want to change the narrative on that, and really get into how can we approach this from a different lens. Because as you said, in family medicine, professionalism is not abstract. It's dynamic. It lives in the exam room. It lives in the relationships that we build, the communities that we serve, the ways that we show up as family medicine physicians in our communities, with our patients, in the C suite, wherever we are as family physicians, we are exuding that family physician identity. And yet, when we teach professionalism, it can sometimes feel disconnected from this reality, right? We have a tendency to reduce it to checklists, policies, correction, chastisement, and really we want to explore a different approach, one that asks how professionalism is not just a standard that we meet, but it is an identity that we form. You said that family medicine is built on relationships, and definitely that is our superpower. If family medicine is built on relationships, then professionalism in family medicine must be relational. And really, we're going to talk about how that can be in our relationship, not only with our learners, but with our patients as well.
I think that's great. I love that you say family medicine. We have a superpower here, that fact that we are relational and there's a foundational framework that we bring to the table around this. And I also like the fact that you're saying we're shifting from that traditional view of standards and behaviors to more of an identity. Tell me a
Right.
little bit more about that shift.
Definitely. I think there are certain things that need to be preserved when we talk about professionalism. We need to preserve the moral code of professionalism. So this is the integrity, the accountability, our commitment to patients, the calling of family medicine. I think what needs to be reconsidered is how we've operationalized that, right? So we talked about it. It's reduced to checklists. It's reduced to appearance. Who's different, who's not, who doesn't fit in, and how sometimes that can be conflated as unprofessional. But in family medicine, our identity is grounded in the principles that started our profession, those who created our profession as an antidote to fragmentation, who really embraced the 4 C's of primary care. Those things are foundational. Those are not just systemic features of a definition in a book. That is the professionalism. That's the professionalism in action. So we want to identify professionalism as not just a performance, but it's identity in action. So to really codify your question, you said, how do I define professionalism today? I define professionalism as the outward expression of our values in service of patients and communities. It is not just what we do, it is how we show up, how we relate, how we navigate complexity with integrity. And as we said, it is inherently relational.
That is powerful. I love how you define that. I might even have you say it again because that was such a powerful definition. The outward expression of our values, how
Right,
we show up
right.
every day. And that ties into, like you said, it's about, yes, we have a moral code, but how do we operationalize that
Mhm,
moral code? How do we operationalize in terms of showing up and
mhm.
expressing those values? I would love for you to kind of help us think about an example of, I'm coming to the table here as an educator, or let's start from that perspective. How do I show up in that space and operationalize that?
Right. So I think first understanding the foundational tenets of family medicine, where our specialty came from, what is important to us as family physicians, what things do we emphasize, I even encourage my learners to go back and read those reports that spurred our specialty, right? The Willis report, the various reports that really showed that there was a need for a general physician. There is an importance that comes from generalism. There is importance in training a workforce that feels comfortable in complexity, that can be the first point of contact, that can deal with our patients in a comprehensive nature. I think emphasizing that to our learners is so very important, not only from lectures or presentations, although I do think there's a role for those, but in the day to day, really pointing out, okay, how does this show up? Where does this place us as family physicians? How can we be the best family physician that we can be in this moment? And so I think that that part is very important, really harnessing those moments and naming those moments. I think as we go on in the conversation, we can talk more about, how do we actually do those things? But one thing I always remember is I was thinking back to, how did I learn these things? Like, how did I start thinking about these things? And granted, I really didn't learn, honestly, I didn't learn a lot about the structural foundations of family medicine, like the history of family medicine, until I probably had been in practice like 10 years. But I did know that there was something that drew me to being a family physician. And I think we all have that experience, right? Like there's something that resonates with us about family medicine, and that's why we became family doctors. And when I found out about family medicine as a reform movement, that people came out and said, no, we need a different approach. We need to see this differently. We need to value where people come from and who they are. It made so much sense to me. I'm like, yeah, that's exactly what I do. Advocacy is important to me. Context is important to me. Culture and upbringing, those things are all important to me. So it made sense that that's why I had been drawn to family medicine. I think we can do a better job of teaching our learners that from the beginning, teaching them this is from whence you have come.
Mm,
Don't be devalued in a
yeah,
C-suite or in a organization that doesn't realize
yeah,
the superpower that you bring to the table. So
yeah.
we need to teach that identity to our learners. That is the professionalism. It's not just what not to do or who not to be, it is what to do, what you should be, and what you already are because
Ah,
you came here with those tools. How can we as educators bring that out in our learners and bring it out in ourselves too? Because it
absolutely.
gets tough out here for us too, right? But we
Yes,
need to remember where we came from and who we are as family doctors.
I think that's great. There's so much to unpack in that, Andrea. So I'm going to kind of just dig a little deeper with that because
Yeah.
you said so many powerful things there. So, I think it's important for us to understand too the role modeling and the role that we play, right? And because we need to make sure we're leading in this space and that our learners, our patients, everybody's seeing us model this. To your
Right.
point, you're saying we're truly expressing these values, but you're also charging us to say, tell the history,
Hmm.
right? And to recognize that what we have become or what we have stepped into as family physicians is a greater calling. If
Hmm.
not, there's a greater why to this, right?
Right.
And so
Right.
using those moments, those teaching moments, those small moments, or the big moments, all the moments that we have, even in those one-on-one with patients or one-on-one with a learner, to
Hmm.
be able to share those moments, and show how it to to express how it shows up in that
Right.
moment too,
Hmm.
and how that helps us to see the why even more, and that the professionalism. I like to say this, I've said this years ago, remembering that lifetimes have culminated in you at this moment, right?
Yes.
And so
Yes.
it's recognizing that power that we bring to that. And the last thing I just really like that you said, it's like we got to flip the coin.
Hmm.
Not about what not to do, but what to do.
Right.
Yeah. And emphasizing that and being in that positive state of that. When we do this, even more so,
Hmm.
that we show up even greater, even more
Yes.
powerful as that
Yes.
superpower. I love
Yes,
that.
exactly. And I want to make a big distinction from the beginning here
Yeah.
and as we go on. Professionalism is different than professional misconduct.
Yes.
We are not
Tell
talking
us
about
more.
professional misconduct.
Mm.
Professional misconduct definitely happens. We definitely need to address it when it does show up. I'm not saying just accept, whatever willy nilly. I mean, there are standards. However, misconduct is about boundaries. Professionalism is about becoming.
Mm.
Who are you becoming? Right? The question is not, did you meet the standard? It's, who are you becoming as a physician? How did that experience help you to apply the four C's? How did you show up as a family medicine physician in that experience with that patient, in that boardroom, in those halls of Congress, right? How did you embody who you are as a family doctor and the traditions that we have taught you and are teaching you and you are teaching us, right? So it's not just about a lecture, but it's about being intentional, like you said, Trish, intentional in those everyday moments. And, I was thinking back as a resident, I know we have a large number. We have UME, GME, med students. Shout out to everybody. This is a process that we're going on. But I was thinking specifically about when I was a resident. Shout out to Harbor UCLA. That's where I trained. And I had one of my faculty members, and let me say, all of my faculty members contribute equally to my upbringing and my training, and they were all wonderful. But one that I will highlight is Dr. Terry Navarez. She always would say, she always had this little saying like, well, because we're family doctors, we're going to do this, right? Because we're family doctors, this is important to us. Because we're family doctors, we have to make sure the patient gets this, or we coordinate that, right? It really imprinted that, okay, this is what we do as family doctors, right? It's not just how to be good doctors, it's how to be good family doctors, right? Like there's a identity that's very specific to us as family doctors. And, at the time, it wasn't like, here's a professionalism moment, but really, that was the professionalism moment. That was the professionalism in action. Here's how I become the best professional I can be. And I think those simple practices, like the structured reflection at the end of the clinic day, you have everybody's kind of sitting around charting, and you have a little, case that we had like a blackboard, but I mean, maybe it's different what they do now, but you have a little case, you're going over, what does this mean? What does that mean? You can ask questions like, how do the four C's show up here?
Mm.
What's the family medicine teaching moment in that? How did you face complexity in this? How does our current laws encourage this or not encourage this, right? What needs to change about, the access that our patient has, like kind of looking at those structural things, what is the tenets of the social contract, where do we see that show up in this? I think encouraging that moment by moment reflection is very important in kind of building those simple practices that can really teach. What we're talking about is the aspirational professionalism.
Absolutely.
Again, misconduct is the floor. That's
Right.
like, don't go below this. And people need to know that
Absolutely.
too. But
Absolutely.
aspirational professionalism, that's the ceiling.
Yeah.
That's the ceiling and beyond, right?
Yes.
Beyond the ceiling.
Yes.
How high
Yes.
can you go? And what's the best way that you can show up in your community and with your patient as a family physician?
Oh my goodness. That is perfectly said, Andrea. I think the fact that you said it's the ceiling, it's aspirational, right? And that
Hmm.
professionalism is about becoming. It's not
Hmm.
about professional misconduct. I think that
Right,
is the point to drive home, that we understand there are certain standards that we have set that we understand are foundational.
right,
But we have to really understand that terms of aligning personal values to professional values and understanding that we are on this continuum of becoming, and it is
right.
truly aspirational. So I think that's powerful, as you said. I'd like to kind of shift then, as you because you brought it up just a little bit there, and I want to kind of shift gears a little bit and think about professionalism now. Now that you've kind of talked about that spectrum of thinking about professionalism as aspirational, as becoming, as understanding, taking those moments to reflect. What ways can does traditional professionalism standards unintentionally, though, may reinforce certain bias or exclusion, especially when we're dealing with those, learners or team members and patients from different backgrounds.
You're right. And, this is an area that can be so detrimental when we don't confront it head on and really understand the origins of where these kind of concepts may have come from. I think traditional standards were created often in a narrow cultural context. And when applied universally, they can unintentionally privilege a certain way of speaking, dressing, interacting, looking. Really, that harkens back to who was at the table when those standards were created. And what often will get labeled unprofessional is just different, right? It's not harmful. It's just a difference. It's just a different way of acting, different way of showing up, different way of appearing. And I think when that happens, when we adhere to those more traditional, more narrow views, or more narrow definitions, I should say, and we don't allow that inclusion, that variety of thought, variety of perspective, we risk undermining the very goals of primary care and the very goals of family medicine. And we know that first contact, continuity, helping patients feel seen, respected, understood, those things are important to us. We know, we have evidence to show they influence outcomes. There's better care when patients feel connected to their physician, when they feel seen and reflected and understood and related to by their physician. So I think that when we shun inclusion, we are missing the highest form of professionalism. Inclusion is professionalism. Inclusion allows the patients to come in and feel like they're a part of the care and that they can get the best care that they're seeking to get. And this is not just racial, this is not just, gender. I mean, this is so many things, right? You grew up on a farm, you grew up on a military base, you've traveled the world, you have this experience, had kids young, you had kids, right? Just all of these things. All of these things make up the identity of who we are, and people can see themselves reflected, and we can deliver better care to the communities that we're serving. So that's what I would say, really expanding that definition of what it means to be a professional. Inclusion is not a threat to professionalism, it is the expression of it.
The expression, that's it, the expression of professionalism. So as we're thinking about trying to be more inclusive, and that's one of our focus areas, of course, this whole series that we're doing around that,
Hmm.
that it's almost another superpower, right? That we
Right,
have
yes.
to be able
Hmm.
to really
Definitely.
have that as part of our dialogue around professionalism, is that
Right.
you need inclusion and inclusiveness to be able to be a part of that. How do we embrace that? How do we learn more about the impact of culture and all of these aspects on professionalism? How do we know that this is another expression or this is within that realm of professionalism when we're having these dialogue or we're seeing this within our teams? How can we be even more present in that and embracing that and learning that?
Yeah, I mean, I think understanding where we all have come from, just opening the dialogue is so important. Having those moment by moment reflections, like we talked about, and end of clinic reflection, or maybe a noon conference that we're talking about, what kind of things we all bring to the table and how that can affect our care. I think when we create environments where those varied perspectives are welcomed and valued, we harness the collective value of the team. This leads to better decisions, stronger coordination, better patient care, understanding that we all have a role to play. But I think a main thing that we need to do is understand what we said earlier at the beginning of the webinar, that this is a dynamic process, right? We can't have a one-time lecture at orientation and be like, okay, we've checked the box, we talked about it, right? Like, this is something that has to keep evolving, keep being discussed, keep being revisited, right? Like, you don't just, I always say, you don't take a shower once and then you're like, oh, good, I'm clean for life, right? Like, you have
Yeah.
to continue, right? You have to keep talking about it and keep addressing it, because the environment is changing. And so we have to change. But we're family docs.
Yeah.
We know change. We know how to keep to the things that are important to us while adapting and growing.
And as family docs, I'm going to also kind of lean into that too. You also said we're very good at adapting.
Mhm.
I want to kind of ask a little bit more, where have you seen potentially that institutions or organizations or leaders or any of us maybe confuse adapting with professionalism?
Oh, this is good. That's a good question. Well, one thing I will emphasize is that one mistake that we make, I believe, as educators, as organizations, is that we only discuss professionalism when there's been a negative, when there's been an infraction, when there's been a professional, when there's been professional misconduct, and or some kind of deviation from the norm. And so then it's like, oh, we have to talk about professionalism, right? And then everybody's like, oh goodness, everybody's worried that they're going to get, some type of a negative mark or, some type of a judgment. And I think, especially in this formative period, UME, GME, you know, our learners are so impressionable. I mean, you hear people talk about hurtful things that were said to them like years back when they were a resident, right? Like, oh yeah, that attending did this to me, or that, HR had said this to me, or, whatever it is. And people are very, very impacted by it and almost never want to revisit it. So I think one thing that we can do from a institutional perspective is have positive conversations of professionalism, positive examples of professionalism, aspirational professionalism, highlighting things like that adaptability, right? Like, oh, look at how this department was able to pivot to, address this need in their community. Look how this, attending was able to do this in this situation or had this conversation with this patient or this learner. Highlighting that adaptability as not deviant, but as important and as useful for the ultimate goal, which is the care of the patient.
I think that's great when you're talking about just really addressing it head on, right? And being
Mhm.
able to have these moments where you're reflecting and creating it as almost a norm of a
Right,
conversation that you'll have. Some things that have come up for some too are those when actually this misconduct does happen. Let's talk about that. A
right, right,
conflict or something or a misstep or something has happened. It's very much everyone sees it and they know it,
right,
and we're
right.
being transparent about it. Are there reparative practices that we can
Yes,
think about, especially also if we think there was a role of bias in that?
right. I agree with you that there are those times as educators that we do need to pull our learners aside and say, hey, I need to discuss this. Something has happened. We need to have a heart-to-heart conversation. I think, first of all, that's the important part, right? A
Yeah,
heart-to-heart conversation. So, making sure the environment is correct, right? Privacy, uh, really highlighting what the learner has done well and what really needs to be addressed, and the goal and why you're addressing it. Not
yeah,
to say, I'm here to judge, but my goal is to help you become the best family physician that you can be. And so, how can we address what's happened? What's going on in your life? What's going on in your family? I mean, I think the period of training, both UME and GME, not only is a period of great learning, but great transitions for our learners, right? They're moving, maybe they just got married, they had a baby, they're figuring out how to, assimilate a large body of knowledge, how to talk to patients. So many things are changing at the same time that I think us approaching those learners with grace and and understanding is very important. But I think tying it back to the greater good, tying it back to where we see them going,
mhm,
understanding that they're on a continuum, and we fully have faith that they'll continue on
yeah,
that continuum. I think is very important. And I will say,
yeah,
and addressing the systemic things that make it difficult
Mm,
for all of us to continue on that continuum, right? It's not just an individual like you be better, right? We do know that there are systemic things. This is called organizational professionalism. We do know that there's ways that we could change our systems. Is there a way that we can address some of the burnout? Is there a way that we can, from a systemic perspective, can we change some regulations? Can we change some laws? Can we advocate for XYZ in our organizations? Can we get a family doc's voice
mm,
at the table for in the C-suite or at the committee that's, determining standards in the hospital? Like what are those things? How can we get those family physician voices in
mm.
those spaces that can make those types of organizational change? This is also part of our goal in the 4Cs. Remember, this is also helping us to deliver comprehensive care. How
Sure.
can we make that happen? And this is part of our professionalism as family physicians.
I think you bring up a great point because we have to not only look at the individual, but we have to look at the organizational and the
Right,
system, right? And so
right.
bring a point up around the systemic challenges that we may face.
Hmm.
Tell us a little bit more about what those could look like. What are some examples? You mentioned the force, making sure family medicine's at the table, is there representation, other things like that to ensure that those values are being communicated across,
Hmm.
that identity is being preserved in those systems. But are there other systemic challenges that we need to be thinking about that we can factor in, especially if we're trying to assess and support our learners and our
Right,
team, think about what may be factoring into this?
right. So I'll give two examples. One is that, I know that we are in a very different landscape. We're practicing family medicine in very different environments where certain environments may face greater constraints in what can be discussed, what can be talked about, how they show up as family physicians. I think that we need to harken back to, well, first of all, definitely follow the rules where you are, right?
Yeah.
Like, you know, we're not encouraging anyone to go outside of any legislation or any local or regional legislation that is that is in play where they are. But, how can we harken back to the things that are important to us as family physicians? How can we deliver that comprehensive care? I mean, what evidence based data do we have to show that having those discussions, having those inclusive voices at the table actually does lead to better care? And how can we, where we are, show those stories and really get change to happen. I mean, these things are within our DNA, right? Advocacy. We teach advocacy. We teach bringing those patient stories to the table where decisions are made. We are the bridge between the exam room and the policy. How do we lean into our role as family physicians and do that thing to help get those changes to be made? So that's one thing. I think from a global perspective or like kind of a regional policy perspective, don't forget how important your voice is as a family physician. Don't forget how important it is that when you speak up and says, this does not work, here's how this is not accomplishing the goals of the hospital, accomplishing the metrics that the hospital wants to see, right? If you are preventing me from having continuity with my patient, then the patient's not going to come back, right?
Yeah.
Like this is important for you to not just schedule the patient with whoever, make sure they come back to see me so that, I can have that continuity. We can accomplish the goals that our institution, our state is trying to get those better outcomes, right? I think even showing up and saying that is very important and having that voice at the table. So things like the continuity, I know that that's a common problem
Yeah.
often where, you know, the organization might just want to get the patient an appointment with anybody, but really they should come back and see their primary care person, right, or their primary care team, or allowing the family physician to practice to their full scope, right,
Right.
procedures. I don't have to outsource everything. I know how to do that. I'm a family doc. I've been trained in this way. Why do I have to outsource this procedure to this other department when I know that I can do that and my patient would feel better if I were able to do that, right? Is there a way that we can adjust the schedule that would allow for a procedure visit, right? Even those are kind of like the nuts and bolts
Right.
things that can, I think, help us to be the best family physicians that we can be. And to me, that's the professionalism as well, right?
Yeah,
How do we function to the highest level of our training?
absolutely. And it connects you back to the why, as you said,
Hmm.
identity that we're
Hmm.
here to provide for our community, that connectedness with our patient, all the things, the continuity, all of that. And for me to be able to have those values be expressed, as you said,
Right.
it allows me to show up in the space for my patient, allows me
Hmm.
to feel that identity and that professionalism
Right.
identity more so. So I think I
Definitely.
like the fact of how you just connected even to the day to day. And
Hmm.
that's how we need to do. We need to think about it that we show up every day in this space for each other, ourselves, and our patients and our communities, expressing this level of professionalism always. Um, so I'm going to actually say this too. Let's talk a little bit about assessment, and then I'm going to segue into another part of our discussion here. But I just want to kind of lean in a little bit more on this piece for our faculty and just our learners too. How can programs actually and faculty assess professionalism more fairly
Hmm.
and
Okay. Yeah.
developmentally, right? It's a
Yes.
core competency throughout our
Hmm.
medical education, right? But while we can also need is there to reduce subjectivity and bias. So
This is
how
true.
can we do better at assessing it?
I think we need to start from the beginning, day one, right? Our learners are showing up to our clinic. They're showing up to our residency programs. Match day just happened. You're going to get a whole new crop of learners. Some wanted to be family docs since they were
Yeah.
3 years old. Some just found out they wanted to be a family physician, right? Like there's going to be a variety, right, of,
Right.
of of experience, of exposure. I never had a family doctor growing up. I had an excellent primary care physician who I learned so much from and was an inspiration to me, but I didn't have a family doctor. So I didn't know, like, I hadn't seen what that looked like from a patient perspective. I had excellent teachers, obviously, UME and GME teachers. But my point is, there's various perspectives coming in. So I think that starting out from like teaching what is family medicine, where does it come from? What are the things that are important? What are the four C's? What how many family docs are? I mean, some of those like nuts and bolts, here's where we're coming from, right? Especially family medicine as a reform movement, especially comprehensiveness, the things that family physicians are able to do, the ways that we'll be trained, what things are valued, and what things will be assessed. I think that's important coming in because often, sometimes we kind of assume people know what to
Yeah.
do, right? We
Yeah.
just we just assume somebody told them somewhere, and then when we're evaluating it, it's like, well, I didn't know that I was, oh, I'm supposed to do this, right? So people, I think we have to be clear about what is being assessed,
Mhm.
making that difference. Like I said, professionalism versus professional misconduct, right? The two are not the same. Explaining that to our learners. I think we need to move toward assessment that's more longitudinal, more narrative, more reflective. Like I said, talking about those things from the beginning, you can do
Yeah.
that in a large lecture series. You can do that in a, small group discussions. But then there's the day-to-day practice, right? How does it show up in the actual clinical care? How does it
Mhm.
actually show up in the way people communicate with one another? How does it show up in uh, how we are reflected outside of the clinic in our communities, right? So, moving towards a more longitudinal, more reflective practice rather than kind of a single point in judgment,
Yeah.
and single episodes that can really make people feel very judged and can introduce the bias. I think that's important. And finally, really checking in with ourselves as educators,
Mhm.
having these conversations amongst ourselves.
Mhm.
Are we evaluating professionalism? Are we evaluating comfort with our own
Mhm.
norms?
Ah,
The way I spoke to that learner, how did I show up? Right? Was that the
yeah.
best way? Was I modeling the best form of professionalism? Is there something that I need to check in on in my house? In my family and in my situation? that's affecting how I'm showing up with the patients. This is a tenet of being a physician as well. Self-care, self-regulation, really checking in with my own self. And am I modeling the things that I'm trying to model for these learners? And I think giving the faculty time to have that discussion, or safe space to have that discussion, is important, because how can we produce the best learners if we haven't, strapped on our own oxygen mask, right? They say before you say that,
Absolutely.
right? You guys strap on your own.
Absolutely.
So that's something that's very important too. So it's complex. It's
Wow.
Trish. It's
Yeah.
very nuanced.
Yeah.
But I think normalizing the discussion, not just having it when something bad happens, having it when something good happens, having
Yeah.
it on a regular Tuesday is important, so that it's normal. This is what we talk about. Okay, that's what we
Yeah.
do.
No, I think
And,
that's great. Yeah. I think you're right. We have to check in with ourselves even before we have the conversations and
mhm,
afterwards too, and just see
right.
what we learn. That's part of our role as faculty, to grow from each and every encounter and each and every experience
Hmm.
we have there too, and to make sure how are we showing up. So I think that's a great faculty development opportunity, even just for some self, like you said, self-reflection and self-regulation. And I think what you're saying in the assessment is make it transparent too, all right?
Hmm.
Everyone needs to know exactly how are we evaluating, what do we call professionalism, what does that mean to us
Right.
here in our own programs, in our own spaces with each other and our patients and our communities. And so, describing what that looks like is very important, and being very clear how you're being assessed, and make sure it's not a one-time thing,
Yeah.
not just at a point of care. It's longitudinal, it's throughout this time, as you said, and then giving the space for reflection of what did I learn from that,
Hmm.
using those skills we know as family medicine and as educators, in terms of feedback and evaluation and
Yeah.
reflection, to create those spaces. So I do
And can
think.
I mention
Sure.
just and you gave a good perspective on feedback, right? We know, like, when we tell our learners, we can say all the feedback, but if we don't say, I'm giving you feedback, they will
Feedback.
say, I never
Give me
received any feedback.
feedback.
Right? So we have to say, like, hey, here's an aspirational professionalism. Here's positive professionalism. Oh, look how this person showed up as a family doc, right? We've
Yes.
named it. And now they can say, oh, okay, yeah, we had this professionalism discussion in a
Yes.
good way, in a
Yes.
positive way, that makes them feel that, oh, I have something that I can aspire towards, and I'm moving along a continuum. So naming it, always
Yeah.
very important.
Naming it and bringing it back to the why and the true north, right? So we're going to talk
Exactly.
about that too. So we have a lot of generations in our on our teams, right?
We
And
do.
so we have to talk about it. There may be varying perspectives, and then
Hmm.
there's also mentoring that's happening, and how we show up, we said. So what generational differences are you seeing right now in how professionalism is being interpreted by our learners and our faculty? Where is that happening and intersecting?
Well, I think it goes back to what we were discussing before, really calling out how inclusion is important, how traditional norms may or may not serve a modern, up to date society, and having that open and honest discussion. What should be preserved? What needs to adapt? What approach needs to change? Different generations may express professionalism differently, but it
Yes.
doesn't mean that they value it any less.
Right.
In fact, many learners are deeply committed to authenticity, equity, advocacy. This aligns very closely with family medicine and the principles of the four C's. I think even now,
Yes.
learners have to even fight harder to choose family medicine and to be proud of being family doctors. They're coming to us having made this choice, and having, in many environments, maybe it's not something that was encouraged. Maybe it was something that was discouraged for them. Unfortunately, this still happens. So when they come to us, they have come and they're like, "Here I am. I've decided that I'm pursuing this specialty because I love it and I want to hear more about it and I want to grow in this." And so I think we can have a tendency to, kind of fall into that, like, the kids these days, and I probably am guilty myself sometimes, but really kind of looking at it from, okay, their lens might be a little different, but what is the same?
Yeah.
What harkens back to the reform movement that was family medicine? People probably said that of of our family medicine ancestors do. They're like, what are they trying to do? Make this new specialty? Uh, but they hearkened in on something that needed to change, an antidote to fragmentation. And they were active and passionate and energetic. And we see those same traits in our family medicine
Absolutely.
learners today. So we need to harness in on that and really bring them along because they are the future of our specialty.
Oh my goodness. Absolutely. Yes. And I see it. I see it just as you see it. I see it every day. They do show up and they want to be a part of that. And I think to your point, it goes back to the identity. And
Hmm.
it's our job also to help them really as they're, to your point, becoming. They
Right.
are
Hmm.
becoming and
Yeah.
they're stepping into this identity. They're
Hmm.
stepping into this opportunity that they have chosen to be a part of and this wonderful specialty they've chosen to be a part of. And so that's evolving. And I think we
Yeah.
also have to give grace to each,
Yeah. Hmm.
all the members of the team and all generations to say, okay, let's have the conversation to your point. I'm going to pause here real quick. I'd love to entertain any questions, just a reminder to the audience, the Q&A. Uh, feature is open. I'll be taking a look at that. We have about 15 minutes left, and I'm going to start looking at that Q&A. So if you do have a question, we'll be rolling into questions soon. But so Andrea, yes, this whole generational piece. And then what can mentors bring to the table, though? If you are feeling that you're mentoring in this space, how do you ensure that if there is indeed a true professionalism concern and you're having this perspective and you still, there may be a misunderstanding of a generational difference of understanding what that is. How do we approach that kind of difference in communication style, maybe, or expectations or things like that, if there indeed is a little bit of a mismatch?
Good question. I think, first of all, checking your own biases, right? Where did I learn my norms? How am I approaching this? Um, what is actually the infraction? What is the thing that I'm viewing as outside of the norm? Is that an actual professionalism concern, or is it something that's just a little different?
Mm,
And so I think that's the first thing in preparing for any type of a talk with a learner. There's several different approach. Like there's some that call it the cup of coffee approach.
mhm.
Hand on the shoulder. Can we talk about this? Can I take you aside? Can we discuss this in a way that is formative for the learner and not punitive? I think setting clear expectations, clear understanding, giving that learner time to express their perspective and their thoughts, and I think making it something that is the norm and not a one-off, not something that only happens when there's something negative. So that when there is something negative, which inevitably will happen, I'm sure even you and I, maybe we could look back to
Yeah.
our training and say, "Oh my goodness, did I actually do that, or did I actually say that?" I mean, like you said, that we have to give one another grace, know that we came from somewhere, and they can come along from that place too. Always emphasizing the growth that we see for them, the
Oh yeah.
growth that we can see in them, the potential that we see in them, the things that they are doing, the things that they are saying, the ways that they did show up, the growth that we see in them as budding family physicians. So, this type of aspirational professionalism, it can happen at the same time that you're addressing a professional misconduct lapse.
Yes.
The two are separate in definition, but they can be in the same discussion. They just have to
Absolutely.
be clearly named,
Mhm.
clearly identified. Here is what we cannot have: X, Y, and Z. I can't have you do this, and this again because of this, and that. This is how it affected the rest of the team. We have to not do that. And how can we change that narrative, right? How can we become better family docs? How can we set up a better team environment that would help you in this way? Realizing that aspirational professionalism is developmental, it's relational, it's inclusive, right? That difference is not a deficiency. maybe it's just a difference. If
Mhm.
it's something that needs to be eliminated or needs to be specifically addressed, we need to specifically address that. But how can we continue to bring it towards the positive?
I really appreciate the fact that you talk about that. These are two conversations. These are the two sides of the same thing that you have to have.
Right.
Maybe expectations around certain behaviors or certain
Mm-hmm.
standards that we all hold. Like, you kind of need to do this, and this is also allows us to provide the best care for our patients and to be there.
Right.
These are just some of the level set areas that we have to think
Right.
about. But here's the other piece that here's the why on the other side and the
Yes.
aspirational piece on the
The
other side,
why.
right?
Exactly.
So that helps us to really, when you do have those conversations, like, what are we aspiring to be? What's your target? What's your goal? How do you want to
Yes.
show up? How do you want to see
Yes.
yourself in terms of that? What's your true north in terms of
Exactly.
why you're here? And I think always coupling that with that helps us to really kind of get, if indeed there is a misstep or misconduct, that gets you
Mm-hmm.
back on track, hopefully, that you
Right.
get you back on track to the why, get you back on that road. But then even if there's not a misstep, it always is good to anchor yourself and center yourself on that why and that
Yes.
aspirational conversation. So thank you so much for that, for sure. I'm going to double check to see. We do have a question here, and I'm going to go ahead and start. Thank you, CJ, for your question. So, Andrea, CJ says, how would you apply these excellent ideas on aspirational professionalism to the archetypal tensions in educational environments, such as work-life balance, individual and collective needs, discomfort and growth, or self-direction and authoritative guidance? So I definitely
Whoa,
understand the
CJ.
question, CJ. That's a powerful question right there. There's a lot of layers in there.
There's a lot of
Mentioned
layers.
the push-pull sometimes where it may be but my work-life balance. These are my individual needs versus the collective needs of the group and others and what we need to do. And so I'd love your thoughts on that.
Yes, thank you, CJ. That's a really great question. I think you really hit the crux of what we're discussing here. I think opening up that discussion in your training environment is the first step, right? Like giving time to discuss it. Maybe it's a noon conference. Maybe it's a after clinic discussion with the few residents that are sitting around. Happens during your retreats or whatever it is. Whenever you have those times where it's like, okay, let's really dive deeper into this meaty aspect. How do you feel about this? How does this affect? How do we reconcile our commitment to the patients with our commitment to our families and our personal lives? How does that show up in how have you, faculty member, how have you been able to reconcile that? How can the learners learn from what you have done, right? So I think giving that safe space to the discussions and not just when someone got called away because their kid were sick and you're like, well, let's discuss work-life balance. No, let's discuss it when we are free to discuss it, right? Like when it's something that's not a punitive situation, right? So I think that's the first thing, giving that safe space, intentionally giving that space and discussing that duality. That's something we all struggle with from for the rest of your life in medicine, right? You're going to struggle with how do I be in 10 places at the same time? So, this is something that's not new and it's not something the learners have to be alone in navigating. So, giving that space, giving examples, showing how the faculty are evolving, becoming as well. We're also becoming too. And so I think that that's something that's very important. So you talked about individual and collective needs, discomfort and growth, self-direction and authoritative guidance. Those are all examples of complexity. That's what we do every day as family docs. We navigate complexity. We navigate complexity with our patients that we're seeing. We know, oh, the patient should be on this dose, but they're only going to be able to do this, right? How can we navigate that complexity? How can we say right now we're going to let that blood pressure be a little high, but you were able to, go to whatever point, right? You have those discussions with the patients all the time when you're kind of balancing what thing needs to come to the forefront and what things does not. So I think we can apply that skill, that relational superpower that we have as family doctors. We can apply that in these discussions as well. But again, big group discussions,
Yeah.
small group discussions if we need to, individual discussions if it's really becoming a problem, really need to take that learner aside, but really kind of keeping the dialogue going. I think that's the important thing. It's not a one and done.
Yeah, it's not a one and done. You've got to have the dialogue and you've got to just make it transparent as you've been talking about.
Hmm.
It's almost calling that elephant out in the room, but
Hmm.
understanding that caring for self too is showing up. And
Right.
how do you want to show up? But we
Right.
also have, how are we fulfilling our responsibilities? And sometimes it's a team approach, but we also have to start with self, right? And so, but holding true to those standards and what we've signed up for is important, but it's also important to realize that part of professionalism is caring for self and reflecting, as you said,
Right.
and having
Yes.
dialogue to
Yeah,
see
I mean
and
that's
where
a
you,
professional requirement.
yeah,
Our
yeah,
reflection, I know a lot of learners are like, "Oh, great, time for reflection."
yeah, yeah.
But
It is
that's how we
part of it.
learn.
Yeah,
We learn from reflecting. That's a John Dewey quote. We don't learn from experience, we learn from reflecting on experience. If you
yeah,
don't think back and say, "Huh, what did I learn from that experience?" You just stumble through life doing the same thing over and over again and you
yes.
never thought like, why am I in this situation again? I do that with my learners at the end of each day. I have 5 questions that I ask them. What did you learn today? What could you improve on? What could you have done better? Tell me one clinical pearl you learned. What question do you want to look up? And what aspect of practice, what aspect of practice did you view today, either from me or another faculty member, that you want to incorporate into your identity as a family physician as you go on, right? So, encouraging that daily reflection, daily, like, okay, what am I taking into the next day from all the experiences that I had in this day? That helps us to cultivate that professional identity. And that's what professionalism is all about.
Oh, excellent, Andrea. I love those 5 questions, and especially that last one that really just solidifies them to be reflective and step into identity. And I'm going to say also, my dyad partner in this work of health equity and inclusiveness is Mary Theobald, and she posted there too that we are going to have a professionalism in medical education curriculum built by our task force here with assessment
Mhm.
tools, faculty
Yeah.
development. We look forward to that. So take a look at that link for our audience. And we are at time here, but I've got to just
Oh,
have you. I know this has been great, Andrea, for me to be able to
I
have some
love
time
this.
with you. And I sincerely appreciate all of this incredible insight that you've provided. Your expertise and your work in this space has been invaluable to our specialty. And I think just in general for all of medical education of what you're doing. I'd love you to be able to just share with us kind of your own final takeaways. What would you like the
Yeah.
audience to basically leave with to know today in this space?
If I had to leave us with one idea, it would be this: professionalism is not just about what we prevent, it is about what we cultivate. In family medicine, that cultivation is grounded in those 4 C's: being present as the first point of contact, building continuity over time, caring for the whole person, including ourselves. We're part of the whole person, and coordinating care across systems. And if we want the next generation of physicians to carry that forward, we must be intentional, not only in what we expect, but in what we discuss, in the spaces that we open up for discussion, what we model, what we name, and what we nurture. I want the discussion of professionalism not to be a, oh, great, we have to discuss this again, but I want it to be something exciting, invigorating, dynamic, a source of pride for us as family physicians. We come from a great legacy. We come from a strong line of family docs who are courageous, who are loving, who are warriors in their communities. You are a part of that. I am a part of that. And I think it's something that we can take pride in, we can be proud of, and we can show up in spaces knowing that our professionalism lives in those relationships. We have superpower as family physician, and so it's time that we step into that and really model the professionalism and the professional identity development that I really feel like we're here to do.
Well, thank you, Dr. Andrea Anderson, for this incredible perspective on professionalism and helping us to step into our superpower, knowing that we are becoming and we're
Yes.
continually becoming in
Yeah.
this space, and our identity as family physicians and as professionals in this space is a powerful, powerful superpower in itself. So Thank you so much for the time
Thank
today.
you.
Thanks to the audience for joining us today. We hope you take back a lot of these great principles and discussion points, and we look forward to seeing you at our next webinar coming up in
Yeah.
June. Thank you, Dr. Anderson. Bye, Andrea.
Thank you. Thank you.